Hi there, my name is Patrick Tonnard. I'm an aesthetic surgeon based in Ghent, Belgium. I work there together with my associate Alex Verpalen. And today we're going to talk about the preparation and the use of Nanofat, especially in facial rejuvenation. We described the Nanofat procedure in 2012 and published it in PRS. And in the meantime, we are using this, well, let's say every day, every week, and we built quite some experience with it. Now, a lot of people are still doubting how to use it. And the secret of Nanofat grafting is that there is no secret. If you stick to a well-described protocol, you will have the same results as we have. And this is the purpose of the presentation of today. Nanofat is a concentration of the stromal vascular fraction by mechanically destroying the adipocytes in the fat, in the microfat. Traditionally, stromal vascular fraction is prepared by enzymatic digestion, and this is there is a lot of regulation about this. It's expensive, so in many countries it's virtually impossible due to the regulation of bioactive medication. So what we have tried to do is concentrate the stromal vascular fraction by a simple mechanical dissociation by emulsification of the fat. And this is what we're going to do now. So what we need is a few very simple instruments. I start with 10 cc of microfat, another empty syringe. First of all will be the procedure of the emulsification, which is done with two emulsifiers. The first emulsifier is a 2.4 millimeter emulsifier. The 2.4 stands for the diameter of the hole in the emulsifier. And then it is followed by another emulsification with a 1.2 millimeter emulsifier. I hope you can read that. I think so. So this is a smaller hole. The reason why we do this in two steps is before we only used the larger emulsifier, and now and then we had the problem that not all the adipocytes of the microfat were destroyed. And when injecting this Nanofat under the eyelid skin, for instance, we had a few cases where we had adipose show under the skin. And by doing this now sequentially, first with the 2.4, then with the 1.2, we are sure that we have destroyed all the adipocytes. So perhaps you're going to ask me now, why don't you use only the 1.2? And the reason is that by only using the 1.2, sometimes when the fat is very fibrous, you are not able to have a nice laminar flow into your emulsification. So by doing it sequentially, first the 2.4, then the 1.2, we are sure that we have killed all the adipocytes, destroyed all the adipocytes, and we are also sure that even with the most fibrous fat, we will be able to emulsify the fat. So I'm going to demonstrate this. We just, now we do this. Let's pretend this is microfat, because I must admit this is a fake fat made of lemon curd. And what we traditionally do is squeeze the fat through the tunnel 30 times, which maximum force, 4, 5, 8. And by doing this, if you do it with real fat, you can already see a change in the consistency of the fat from a more fibrous, gelish consistency to a more liquid consistency. And you can also see a change in the color of the fat from more yellow to more whitish. And now we are using the 1.2 millimeter emulsifier, and we do it a second time, 30 times. 2, 3, 4, 5, 6. You can feel that it is a little bit harder to perform. It's important that you do it with full force. The idea is to mechanically kill cells. Just don't do it like this easily, but like with full force. Another 30 times. And then, finally, we will filter the fat through a double filter. It's a 600 and 400 micrometer filter. And this is the new disposable device that Tulip developed. Before, the filter had to be assembled and was not disposable. And now the idea is that you just squeeze the fat through the filter, and here we are. The reason why we have to filter it is because there are still fibrous remnants in the emulsified fat, and these fibrous remnants will block our 27G needle, because we will inject this fat with a very fine 27G needle. Now we're gonna transfer the fat into 1 cc syringes, and then we're ready for the fat grafting. And then we use the very fine 27G needle, and as you can see, it's very liquid and it comes easily out of the of this 27G needle. That's why we have to use the filter before injecting it into the skin. Now, very important is, with regard to the indications, is that nanofat, because the adipocytes are destroyed, this means that the nanofat has no filling capacities. There is a lot of confusion about this. I can feel that people ask me, you are filling the wrinkles with nanofat? No. The idea is to enhance the quality of the skin, there is no any filling capacity into nanofat. And now we go into a demonstration on the cadaver head. So a typical indication for nanofat grafting is blue circles in the lower eyelid. And we're going to inject the nanofat in the area, the thin eyelid skin. So that means this is about the area that we will treat with nanofat. Now, there are different kinds of blue circles on the lower eyelids, and the best indication is when the eyelid skin, the lower eyelid skin, is so thin that it becomes transparent for the underlying orbicularis muscle. So we have prepared the nanofat, and we will inject the nanofat as superficial as possible. So with the 27G needle, I have bent the needle a little bit. I go just under the skin. For sure, I'm on top of the orbicularis muscle. And while I'm withdrawing, I inject a small amount of nanofat. Here you are. And we do this fan-shaped. You can do this even without anesthesia, because the needle is so small and you see exactly where you are injecting without disturbing the anatomy by the local anesthetic. Normally, for a whole lower eyelid, you need about 2 to 2.5 cc of nanofat. Key is that you are very, very superficial, and you go on for the whole lower eyelid. When you do that, it will look a little bit frightening, because it looks like you create a huge xanthelasma. But as I told you, we have destroyed mechanically all the adipocytes. So even the next day, the yellowish discoloration is gone, and the next week it looks still a little bit red, inflamed, and that's it. So you can go on for the whole lower eyelid. Morbidity is very limited, except for some inflammation, and that's it. Another good indication is the skin of the upper lip, which is prone to aging due to the repetitive movements, and in the same way, you can do nanofat injection very superficially, inject upon withdrawal, fan-shaped, so you inject over the whole surface of the lip skin. Nowadays, we are more and more using the microneedling device. I will talk about this during my lectures. And this is a very promising technique that we are developing nowadays. So it is as simple as this.